Now it's audible, Abhishek.
Yes, ma'am.
Okay. So we were discussing related to the medical legal cases. Okay. So recognize means whenever I talked about like medical legal cases where we need to involve a third party, that is your third party, that is your basically, if I say, that is legal department. Okay, so we need to consider those cases from the legal point of view. So whenever there are certain medical conditions where we need a legal investigation, those conditions will be considered as a medical legal cases. And why we need to have a different policies for medical legal cases, because we are not sure, might be for us that thing is not that much important, it is a piece of cloth or something, but for investigation point of view it may be I can say proof for investigation. Okay. That's why the policies are varying. Okay, recognize the various needs of the patients and meet them without delay. Okay, so we consider the various needs of the patient without delay. Next is the nurse should find out likes and dislikes of the patient and in his plans of care. So I told you what is the importance of likes and dislikes of the patient, depending upon the age, depending upon the behavior of the patient, and everything. So it will make the things easy, because when we are not well, we need a special care and concern. So when someone from the external organization taking care of our choices or our taste buds, so that will change my psychology towards them, and I feel more happy. So that was the major concern ki why we were taking care of the patient's likes and dislikes. Care of patients valuables and close, records the patient medicine and book if available. Okay, so whenever you go into the hospital or if you are working into any kind of training facility, what you will see कि on daily basis 9 a.m. पे vitals इतना था, 10 a.m. पे हमने 10:30 पे जो है breakfast time की whatever the medicines has been dispensed to the patient or given to the patient, everything will be recorded into that book. So what for what reason? To maintain, because being a human, I cannot remember everything. I cannot remember every person's data by brain, because maybe मान लो मेरी शिफ्ट 8 बजे तक थी, फिर 9 p.m. से डिफरेंट नर्स और डिफरेंट मेडिकल स्टाफ. सो इफ आई डिक्टेट हिम कि मैंने 9 p.m. पे इतना इतना मेडिसिन दे दिया, मे बी कोई मिस ना हो जाए, बिकॉज दैट रिटन प्रूफ इज self explanatory, I can say, कि whosoever is on the working station at that time, they can go through that logbook and check कि okay बेड नंबर 9 का क्या क्या मेडिसिन डिस्पेंस हो गया, क्या क्या पेंडिंग है, so they can work accordingly. So this is the importance of medical record maintenance or logbook maintenance. Okay, next is transferring the patient may be transferred from one room to another depending upon the severities. हम उनका wards change करते हैं, ICU से जो है आप normal wards में लाएंगे, general wards में लाएंगे, और ER से आप wards में shift करेंगे. Depending upon the needs of the patient, we can shift their rooms also within the healthcare facility for several reasons. Okay, different types of rooms such as private rooms चाहिए patient को, transfer of patients personal reasons, such as one is more not compatible with a roommate or medical staff, so may request कि I want to get transferred into another room where I can get different facilities or different roommates as per their needs. The transfer will be possible. Okay. The physician may request the patient to be transferred from one level of nursing care to another level because of change into the patient condition that I told you. Okay, from ICU to ward or from ER to ward. So depending upon the needs of the patient get transferred as per the request made by doctor, treating doctor. वो किस बेसिस पे कर रहा है? बेसिस पे ये है कि पेशेंट का हीलिंग प्रोसेस कैसा चल रहा है, ट्रीटमेंट में कितनी care की requirement on the basis of that. Patient can be moved into the intensive care when his conditions become more critical. और जब stable हो जाएगा तो he can move to the wards. Okay, transfer onto the regular medicine floor if his condition improves. Sometimes the nursing staff will be transfer a patient closer to the nursing station where the patient conditions can be supervised more closely. Patient may also be transferred if the room location or the equipment in the room is needed for the more critically ill patient. So for example, same floor पे दो तीन patients हैं जिनको same set of equipment should be required, like monitoring, certain monitoring equipments, vital monitoring, or I can say cardiac monitoring or emergency tables required. So what we can do is we can place all patient rooms nearby, so it will be easy to move and time should be less consumption of time, I can say, or approach to that particular device is easy for the nursing or paramedical staff. Okay, if the patient do not ask to be transferred, he or she may be upset, especially if the patient does not understand the reason of the transfer. Okay, so in such scenarios हम patient को transfer नहीं करेंगे. Okay, next is होगा वहां पे लेकर whatever the these are the basic responsibilities. Okay, moving the patient, before moving the patient, make sure the new room should be hygienic, clean and everything. Okay, and whatever the needs of the patient should be there. Okay, so new room or the floor is ready to receive the patient. So आपका रिसीव द पेशेंट मीन्स कि उनके नर्सिंग स्टाफ की तरफ से क्लियरेंस हो, वो बेड, पर्टिकुलर बेड जहाँ पे हम उसको ट्रांसफर करना चाह रहे हैं वो खाली है कि नहीं है, एम्प्टी है कि नहीं है, प्रॉपरली क्लीन, और एवरीथिंग शुड बी हाइजीन, मेंटेनेंस, न्यू बेडशीट, एवरीथिंग शुड बी डन और नॉट. ओके, आपका स्टेरलाइजेशन प्रोटोकॉल फॉलो हो रहा है नहीं हो रहा, रूम को फ्यूमिगेट किया गया है नहीं किया गया, क्लीन किया गया नहीं किया, एवरीथिंग शुड बी टेकन केयर प्रायर टू द मूवमेंट ऑफ पेशेंट. ओके, इफ द पेशेंट इज मूव्ड इन द बेड एंड द पर्सनल बिलोंगिंग्स कैन बी प्लेस्ड ऑन द बेड. ठीक है, अगर पेशेंट का बेड के साथ इफ वी आर मूविंग in say bedridden patients or severe conditions, so what we will do, we will do all the personal belongings of the patient should be kept on that bed. Okay, check the draw. Then next is patient should be comfortable position with the side raised and raised. So whenever I told you कि bed में auto adjustment switches होते हैं, so on the based of that particular medical condition which is the most comfortable position, and we will discuss with the patient also, on the basis of that we adjust their beds. If the patient is moved by the stretcher or the wheelchair, move the patient first and then move the patient's belonging on the cart. So you can see कि how the things changes. अगर bed के साथ move कर रहा है तो belonging साथ में जाएगी, अगर व्हील चेयर पे जा रहा है तो पहले पेशेंट जाएगा फिर बिलोंगिंग्स जाएंगी. ठीक है, prevent the falls and never leave the patient alone in halfway when you are transferring him or her to the another floor. So जो भी पहले का नर्सिंग स्टाफ जो पहले आपका केयर कर रहा था वो साथ में जाएगा until unless वो न्यू नर्सिंग स्टाफ को हैंड ओवर नहीं दे देता. When the patient arrives into the new room, introduce the patient to the persons who is taking care of them and their new roommates. अगर शेयरिंग में है तो प्राइवेट है तो आप सिर्फ नर्सिंग स्टाफ से उनका इंट्रोडक्शन करवाएंगे. Orient the patient to the new room, assist the patient into the bed, comfortable chairs, attach the signal cords within the ease reach. Okay, so that I told you na ki bedside pe there are switches that is called a signal cord. Okay. It may be fixed with the bed or it may be a detachable one. अगर detachable one है तो आपको जो है वहाँ bedside पे या patient की reach के around जो है उसको place करना है ताकि he and she can easily use that particular facility. Okay. And make sure whenever the earlier nursing staff is leaving, make sure the patient is fully accommodated into that particular room and he is comfortable before leaving. Okay. After transferring the patient into the new unit, return any wheelchair stretchers used during the transportation to the proper place, clean the patient's room, report the nursing supervisor when the room is ready for the another patient, and discharge or dismissal from the hospital means the departure of the patient from the hospital should be maintained. Okay, the purpose of discharge क्या होता है कि why we are discharging the patient, because patient is in better condition now, he is ready to get discharged, the hospital has done his own part. Now the follow-up visit should be taken care. Or second reason क्या हो गया, referral to the higher centers or other health agency. So these are the two reasons for the discharge. Okay. So whenever we are discharging any patient, what all things should be taken care? Proper safety, efficient return of all patient clothing, valuable things should be checked by the hospitals, equipments, clothing stay in the hospital, everything should be checked and discharge will be processed. Next is to assess the patient to manage the successful discharge from the hospital environment to the home environment and provide the continuity of the care at home. So आप home पे उसकी continuity care को check करेंगे. What are the different types of discharge? So these are the different types of discharge. Cured and discharge, that is the first discharge. कि patient आया उसका treatment हो गया, now he is cured and he is discharged from the hospital. Second is LAMA, leaving against the medical advice. Okay, due to personal reasons, patient is not satisfied with you, or he is not happy with his treatment, or he want to be go to certain higher facility, or he don't want to be get treated, whatever may be the reason. Okay, so this is LAMA. Okay. DOR, discharge on request. Patient requests the doctor ki please kindly discharge me, I don't want and anything. So discharge and request. Absconded means leaving the hospital without any prior information. Okay. Next is transfer to the another hospital. Okay. And last is death. Patient expired due to hospitalization. डिस्चार्ज प्लानिंग में क्या होता है, डिस्चार्ज का प्रिपरेशन करते हैं, फिजिकल कंसिडरेशन, साइको कॉग्निटिव कंसिडरेशन एंड फैमिली कंसिडरेशन. सो दीज आर द थिंग्स which we plan when we are planning for any kind of discharge. Steps of discharging a patient. Make sure there is a written instruction for the discharge and follow-up description. Second is make sure that the family and the patient understands the instruction. मैंने आपको पहले ही बोला था कि for example लोकल लैंग्वेज में इंस्ट्रक्शंस होने चाहिए. अगर हम उन इंस्ट्रक्शंस को प्रॉपर नहीं देंगे, फॉलो अप नहीं होगा, तो प्रोग्नोसिस पुअर हो सकती है या सीवियर डिजीज कंडीशन में पेशेंट हॉस्पिटल में रिटर्न कर सकता है. ठीक है, तो डाइट, मेडिकेशन, एक्सरसाइज, एवरीथिंग शुड बी एक्सप्लेन. इफ द पेशेंट एंड रिलेटिव डिसाइड टू लीव द हॉस्पिटल अगेंस्ट द एडवाइस ऑफ हिज डॉक्टर, लीविंग हिम अगेंस्ट लामा. ठीक है, तो अगर ऐसा है कि अगेंस्ट द डॉक्टर एडवाइस पेशेंट लीव कर रहा है या उसके रिलेटिव उधर से ले जा रहा है, तो हम उस केस में लामा लगाते हैं, लीव अगेंस्ट द मेडिकल एडवाइस. ओके. ट्रांसफरिंग द पेशेंट टू अनदर हॉस्पिटल, that is referral. Okay, for further treatment. Sorry, I missed the point. assess the patient to rest. अब फॉर एग्जाम्पल कि आप पेशेंट को डिस्चार्ज कर रहे हैं तो वो अपनी ओन क्लोथ में हॉस्पिटल से घर जाते हैं, हॉस्पिटल का जो भी गाउन है उसको वो हॉस्पिटल में रिटर्न करके जाएंगे. कलेक्ट द डिस्चार्ज स्लिप एंड prescriptions that the patient is to make him for the follow-up cases. Okay. Complete the patient records and discharge summary. Transport the patient records and his belonging via wheelchair and care of unit after the discharge. So once the patient is discharged, again you need to sanitize, clean, and everything should be done. So these are the different steps of the discharge. And whenever we are writing the type of discharge, we are mentioning ki lama hai, door hai, whatever may be the request, we will write over there. Okay. Role of nurses in the discharge procedural. Why patient should be discharged without a doctor written order. The physician writes on the patient chart. The patient to be discharged. The instruction regarding the further care, medication, treatment, follow-up should be clearly written and interpreted to the patient and his family members. Whatever may be the instruction, आप written फॉर्म में भी देंगे, ओरली उनको एक्सप्लेन भी करते हैं कि क्या क्या मेडिसिन डिस्पेंस है, क्या क्या ध्यान रखना है. All those things should be written over there. Provide the patient with a medical direct him to purchase what is the need for him, and entry of the patient should be there in discharge register with the identification data जो भी कि आपका है कि DOD है and remarks, whatever may be the remarks you need to write. DOD means date of discharge. Okay, so all those things will be written over there. Any of the hospital property that was given to the patient for his use in the hospital should be checked, received before he leaves. The article in the patient unit should be checked and see they are complete, including the bed line. Before the patient leaves the hospital, nurses should confirm whether he paid his all bills, hospital bills, and things to the all those bill payments, everything should be done prior to discharge. So once everything should be clear, in that scenario, we discharge the patient. Okay. If the patient leaves the hospital against the medical advice, he should be asked to sign the release form. So in that scenario, we get a consent or release form signed from the patient where he or she will be responsible for their decisions. Doctor is not, or the hospital department is not neither responsible for any of that particular condition. So these are the forms which will be filled and recorded. Okay. Next is medical legal cases where the patient who is admitted to the hospital within unnatural pathology has to be taken care and in occurrence within the policies and codes like road traffic accidents हो गए, आपके injuries or self inflicting injuries during the fights हो गया, suicidal हो गया, burn हो गया, poison हो गया, and rape victims. Okay. So all these things should be, considered as a medical legal cases. In initial treatment देने के बाद we consent to the, connect with the legal department. I can say that is law. The nearest police station should be informed. They come and investigate the case or record the medical legal case summary. Okay. So these are the things which should be taken care. Okay. And done. So what is the role of, if I talk about related to the nursing staff during the admission? So first is to obtain the complete history. Okay, how this accident happens, what is that? And then if the child or if it's a case of child, then we connect with the patient's family member, okay, to obtain the history in that scenario. Or the member who is bringing that patient, if the patient is not able to tell, in that scenario, we connect with the person who brought them to the hospital. Okay. See how they met with the patient, what is the exact condition when they met with the patient, and what all those things, whether they are relative, non-relative, everything should be informed. Then what we will do, we inform the police on duty in the hospital and the CMO. Okay. So if there is no police on the duty in the hospital, in that scenario, we inform the CMO and call the nearest police station. Okay. When it is made an MLC, record the patient's file, link with a red ink on the right top corner. Okay. So MLC में हम top corner में red ink से उसको mark कर देते हैं कि this is a case of MLC. Okay. Next, do not give any statement about the patient condition to the police or magistrate or media. Again, because we need to maintain the HIPAA protocol. So we cannot give any statement into the media or to the magistrate or anyone. Okay. Only the doctor is authorized to give the information. Being a nursing staff, you cannot give. Only the doctor, he or she is authorized to give the statement to that staff. Particular legal staff, whosoever is police department, magistrate, whosoever is there to investigate the case further, they in that scenario only doctor can give. Roles of the nurses in MLC during the discharge: when the patient to be discharged, inform the police on the duty and hospital CMO, and discharge only after their clearance. So in that scenario, what happens ki once the legal team, they have given their clearance and CMO, he or she has given their clearance, then only these patients can discharge. If MLC patient abscond, and inform the CMO and immediately and the treating doctor. No MLC patient can go with LAMA. Okay. Document and the care given patient immediately, accurately and duly signed. Notes should be handed over the authorized person and designated by the hospital authority. So all these things should be done. कि आपका जो भी notes है, जो भी nursing notes है, patient का क्या time है, medication, everything should be signed. जो भी nursing का consent, everything should be signed and submitted to the patients. Okay. In case of death of an MLC, the body is not handed over to the relatives. In that scenario, that body is handed over to the legal department. Okay, it need to be accurately labeled and sent to CMO or police officers should be informed simultaneously. अगर death condition है तो आप CMO और उनको inform करेंगे, body को आप relatives को नहीं देंगे, they will investigate and they will send it for further reasons. So conclusion is the standardization of the admission and discharge procedure are largely in our control. If I talk about whosoever is doing the management part, nursing or paramedical staffs working, majorly they are playing important roles. Okay. Being a hospital management is a very important part कि आपका जो भी admission है, जो भी discharge है, they play important role. And is play important role why? On the basis of that only the number of beds into your hospital, the facility you are providing, on the basis of that only you are going to increase. Okay. So this is the basic conclusion from admission to discharge. What are things we need to take care? Okay. Now all patient related services and assistance, good communication skills में क्या क्या important चीजें हमें माइंड में रखनी चाहिए या क्या क्या पता होना चाहिए. So patient admission services में most important thing is your registration process. Means the moment he arrival into the hospital, how your staff greets, how they guide them. For example, you go to the certain hospital, there is no one to guide you, you don't know how to proceed into that particular condition. What happens? You get frustrated. Okay. And you move to the another hospital. When you reaches to the second hospital, there is a person who can guide you, what's the reason at the reception, they will help you through, assist you, and they are very polite, sweet. Definitely you go to, next time if something condition happens, you go to hospital 2, not hospital 1. Okay. So again, during your communication or your staff we are hiring, their communication skill play important role. Okay. So upon arrival at the hospital, patient should be greeted by the registration staff, collect the demographic information, insurance detail, and medical history. This process ensures the accurate patient's identification, establishment of the record, and hospital system. Registrations staff also verify the insurance coverage and obtain the consent form and assess a unique patient identification for tracking purpose. So these are the basic things Unique identification tracker means they are providing you the number. Okay. You can say every hospital they provide you a registration number that is very unique. Okay, so on the basis of that registration number we can track that particular patient. Okay, like Aadhaar we have, everyone is unique, in same every hospital has a unique registration number. Okay, next is your medical assessment and triage. Patient undergo the medical assessment by the health professionals, evaluate their health status and prioritize the case on the basis of urgency कि उसका कितना need है treatment को avail करने का. If he is okay for the medical part, we will provide them. On the basis of medicine, OPD basis पे cure करके we will discharge. If we see कि no, this patient should be admitted, in that scenario we admit them and provide the treatment on the basis of that only. Okay, next is room or bed assignment. So once the doctor has been taken care of, after the medical assessment, the patient is assigned to the hospital room or a bed on the factors such as medical needs, bed's availability, patient's preferences. Room may vary in types like private चाहिए उसको, semi private चाहिए, all those things and amendments. Then it should be taken care कि patient का क्या facility है, कितना pocket उसको allow कर रहा है, what kind of choices he wants to make. On the basis of that we allocate them their rooms and amenities. On the basis of rooms, the amenities varies. Efforts are made to accommodate the patient preferences within the possible ranges, whatever. For example, patient का demand है कि हमें तो sharing room चाहिए, 2 sharing room, 3 sharing room. For example, he's asking for 2 or 3 sharing room, but we don't have at that time. So we ask them कि okay, if you can accommodate into the private or semi-private rooms. So on the basis of their choices, we make the possible adjustment. Okay, assignments are communicated to the nursing staff and documents into the patient electronic health record for the continuity of the care. So whatever the changes we are doing, we are simultaneously going to maintain those changes into the ER forms. Okay, or EHR forms. Consent from the legal documentation, patients or their legal guardians, whatever the procedure we are going, हम उनको consent form explain करते हैं, what is the alternatives of these particular treatment, what is the purpose of treatment. We explain everything to the patient. Once they understand, we ask them to sign कि हमने आपको ये सारा consent बता दिया है, what is the choice of your treatment. जो भी वो choice of treatment को accept करते हैं, on the basis of that we go ahead and उनको हम वहां पे opportunity देते हैं कि they can ask their doubts and clear their doubts, and once they clear their every doubts and everything, we sign the legal documents and in advance and do the treatment accordingly. So legal consent form documentation should be signed. Okay, next is patient assistance services, accessibility and navigation of the assistance. Once the patient is provided the assistance to patient within the mobility limits, disabilities, language barriers to navigate the facility. Why we have to provide a assistance? So for example, patient may feel, he or she may feel difficulty with a language. So they need someone who can communicate easily with them. Okay. Then they are disabled, physically challenged or mentally challenged in that scenarios. They are suffering from any kind of trauma and they cannot do their mobility, or they cannot walk easily, or in that scenario also. Okay, so on the basis of the patient need, we provide them, the wheelchairs, ramps, lifts, whatever may be the, or stretchers, elevators, whatever may be the needed. We find our best possible ways to help these patients. Okay, or we can put a signboards for the self-explanatory signboards to direct them. Next is your financial counseling and insurance guidance. In India, very rare people, I can say out of 100%, only 20 to 30% people are availing the insurance policies. So if they are having insurance policies, we need to check what insurance they are having, whether that particular insurance is offering this particular medical treatment or covering this particular medical condition or not. Yes, if yes, then we send them what kind of facility they want to avail, whether a reimbursement, whether a cashless facility. Reimbursement means what happens, initially the patient will pay to hospital, and then they will send their documents to the insurance company and they will reimburse bank. Second is your cashless facility, where what happens ki hospital take a prior permission, they send the document to the insurance company after reviewing all those medical documents, if they need additional they will ask, and on the basis of evaluation of those documents they will give ki, okay, you can give a verbal consent, or I can say a approval to that particular authorization to that particular hospital ki, okay, you can proceed for this condition, and we will liable to pay up to this much amount. Okay, on the basis of that treatment gets started. Okay, so and this is what I told you about related to the insurance programs. Okay, okay, insurance policies ka coverage ka. Okay, on the basis of coverage also we check another thing is paneled, that particular hospital is paneled with that particular insurance or not. So geo limit coverages are also there. Geo limit coverages means कि आपका hospital panel है कि नहीं, ये तो different thing है, but what is the maximum? For example, if I am taking staying in India and my policy, in what all parts of India it is effective, what in what all hospitals. So if I talk about hospitals, hospitals are the networks. So what is the network panels of the network of that particular insurance policies? Okay, okay, in which networks they work. Okay, second thing is कि what is the my geographical limit कि भोपाल में वो पॉलिसी वर्क करेगी कि नहीं, कि ओनली इनटू माय होम स्टेट काम करेगा, or a national level pe everywhere it will work. So all these are the different terms and conditions of health policies. Other than this, what is the domestic के अलावा international में किन किन areas में वो policies cover up हो रही है. So these are the basic things which we need to check here. If the patient is not having any kind of insurance coverage, then we will explain the financial counseling. Okay, key what is the coverage and what is they have to pay from their pockets, you know, कि आपका कॉस्ट जो है इतना से इतना आएगा इनिशियली, विल यू एबल टू पे, वी हैव 2 to 3 टाइप्स ऑफ ट्रीटमेंट, इनिशियली में इतना, अगर आप सिंगल रूम लेंगे दिस विल कॉस्ट पर डे, इट विल कॉस्ट, सो lump sum amount we just explain to that patient. In case of insurance we explain, this is where the patient is not having any kind of insurance. Okay, in case of insurance we explain one more thing, that is out of pocket, means ki like आपका gloves and medical supplies insurance companies are not going to pay. So we will say कि insurance will cover up to this much, but medical supplies and admission charges you have to pay. So this is out of pocket. So we need to explain everything very clearly to the patient so they can feel safe. Otherwise, if we hide certain things or insurance also hide certain things, so they will feel cheated. Okay, so whenever we are doing any kind of financial counseling, we need to be very clear with the policy wordings of that particular patient. So what is the exact policy wording, what is the coverage of that policies, and what all things. So financial counseling and insurance guidance is very important, because in India people get the insurance but they are not very clear ki what all things that particular insurance is going to cover for them. Okay, next is interpreter services. Means hospital offers the interpreter services to the facility, communication between the patient and the healthcare providers who speaks the different languages and using the sign languages. जो physically disabled patient है उनके लिए भी ये facility provide की जाती है कि they can communicate easily. Okay, so interpreter should be there. Okay, for the change of information between the patient and the doctor, and confidentiality should be maintained. Next is support for the special populations like unique needs, pediatric बच्चों के लिए, geriatric old age के लिए, ठीक है, and vulnerable populations means those people who are suffering from specific conditions, disease conditions. Okay, जैसे कि HIV, AIDS, all these conditions will be coming under vulnerable patient populations. Okay, So again, we need to take care of these patients very, I can say, like, with a sophisticated care should be taken care, because in these scenarios, along with the therapy, these the person who is dealing with them, their nature also plays important role, ki what kind of care they are giving, because they get easily feel anxiety, or getting uh, I can say dull feeling easily, you can say, no, from the behavior of the person. So very sophisticated and experienced person should be required to promote the coping into these kind of patients. Okay. Next category, if I talk about what is a clinical services. So what all clinical services we are going to provide to that patient. So for example, clinical services, if I talk about like the medical consultations and examination, next is diagnostic procedures, treatment modalities, and pain management and palliative care. So these are the basic four categories in the clinical services. First is medical consultations, where doctor can come and check in, uh, do on the basis of physical examination, or on the basis of medical history, on the basis of sign and symptoms. They come to a diagnosis. On the basis of that, they will tell you what is the exact health status of that particular patient, and make their decisions. Next is the diagnostic procedures. So diagnostic procedures means doctors, in case of dilemma, or they want a more clear picture of the patient condition right now, so they will further go for diagnostic investigation, and like CT, MRI, lab tests, everything, blood tests and imaging, electrocardiogram, pulmonary functions, all tests will be done. On the basis of that, treatment will be given to the patient. Next is the treatment modalities. If I talk about what all treatment modalities we have, anyone can tell me?
Uh,
Yes.
treatment plans, it depends on the based on the treatment plans and diagnosis. Like
Okay.
all the when a patient comes to the hospital to the OPD, whether the
Hmm.
patient need any intervention or any planned surgery, or it's an unplanned. Suppose it comes to the patient comes in an emergency for severe abdominal pain, and
Hmm.
in the investigation it has been come that the patient need to be done appendectomy. So that is also it's an sudden uh, case. So we need to plan accordingly and immediately go for an operation.
Yes,
Or it
good.
depends, like it depends on the every particular person or individual and which type of cases we are getting in the hospital. Like
Yes,
they
whatever the
they're
may
the
be the severity of the cases, on the basis of that we decide ki whether we will go for a conservative line of treatment, whether we will go for any kind of emergency line of a treatment,
emergency
whether
level.
first, yes, on the basis of the particular patient condition, ki whether he need a surgical treatment, whether he need a conservative line of a treatment. Okay, so on the basis of that, ki conservative line of treatment includes your the different kind of medicines, different kind of
Medicines,
alternative therapies. That
alternate
therapies may be any kind of rehabilitation therapies, like physiotherapies ho gaya, or
physiotherapy,
occupational therapies, or
stroke
speech.
rehabilitation, or post,
Yes.
yeah,
So
exactly.
all these things will be, taken care. So that is your treatment modalities. कि कैसा
Yes,
आप treatment particular patient को at the time of disease condition provide कर रहे हैं, ठीक है?
provide that.
Emergency है तो आप उसकी life save करने के लिए definitely you will try your best. Whatever may be the basic life support से लेके advanced life support, whatever may be the required, you will give. Okay, so that is a part of your treatment modalities. Next is pain management. If I talk about pain management, that is hospital prioritizing. First, we able to check what is the exact level of pain scoring. Okay, ki how much suffering he has. Then on the basis of that, we will check ki medication, oral medication will work, or any kind of infusion we need. Okay, any kind of IM we need to give, IV we need to give, or any kind of infusion we need to give. So on the basis of that suffering, or we provide the patient treatment. Okay, कि आपका IM देना है, oral देना है, IV देना है, in order to cure the patient's improve the suffering or decrease the suffering of the patient and improves the patient condition, I can say. This for what we will do the pain management. Okay, so we do a different type of pain management on the basis of nature, intensity, and what is the modality of pain. On the basis of that, we do different types of management approaches. That is your pharmacological and non-pharmacological or interventional therapies. These all things should be done based on the patient needs. Okay, so chiropractic, for example, in back pains also, if I talk about, so आप painkiller दे देंगे, that is a pharmacological approach. Okay, or you are giving a IV, IM or infusion, that is a pharmacological approach. Second thing, what you are doing, you are going to do physiotherapy. Next, what you are going to do, chiropractic. So chiropractic, everything, it takes time, but maybe patient get relief forever. But if I talk about pharmacological approaches, it is a temporary relief. So depending upon what is the cause of that particular pain, we prescribe the line of treatment to the patient. What is the exact uh, treatment line you can opt, and it will give relief for a long. Okay. But if a patient with a pain of, I can say, calculi, renal calculi, and radiating to another side or back, what happens? Patient come to the hospital. We will check what is the size of. First, we will give a tramadol injection or any kind of painkiller. Once he will getting relief from that pain, spasmodic pain या जो भी muscle pain या radiating pain है, उसके बाद we will do the ultrasound. We will check what is the size of the stone. On the basis of that, we will check is medicine is effective or we can go for any kind of surgical removal of that. Okay, so this is how we are managing the pain. Okay, next is patient education and empowerment. So we have different programs inside the India also, and on government level and on private level. So whenever the patient is coming to the hospital, we do a certain kind of education to that depending upon the class. Okay, so health literacy programs where the hospital offers the health literacy to initiate the educate the patient about their medical conditions, treatment options, and self-care practices. So these education materials will be provided to the patient, or interactive workshops should be done, or multimedia videos, audio should be processed and explained to the patient into the multi languages, and cultural appropriate formats enhance outstanding health literacy. One of the best example of this is during the COVID, the different Amitabh and different this media personalities are coming and talking about that particular condition. Why? So the people can understand. Okay, if any doctor is coming and talking to the people, they will feel more depressed and they will not listen. But the media people or these Bollywood peoples are coming and discussing because they had a huge fan following basis. People will listen to them. Might be due to fan following reason, they will try to understand, because the educated class of people, if being a doctor, if I talk, they will easily understand. But for uneducated class of people, if I am going to, as a doctor, going to explain them, you should do this, only 2 to 3% people will follow. But someone from these from actors, or they will come and explain, might be they will listen. So these are the different health literacy programs where we are discussing on a different upcoming issues into the society. Okay, so it will be done through different ways, like education materials should be provided, or media multimedia sources will be planned by the government or by the hospitals. Interactive workshop should be done. Okay, and other than this, we do interventions aims to empower the patient, and informed decisions should be done. So camps and everything should be done in order to explain the treatment plans and everything, so patient can understand. Free camps and all those things will be done for effective systemic health approaches and all. And other than this, government is also doing a lot of health program for these peoples below poverty and all. Next is disease specific education. For example, we have nicotine programs. Okay, we have HIV/AIDS programs, we have tuberculosis programs. Why we are running such diabetes, or non-epidemiological conditions, epidemiological conditions. सबके लिए we have a disease-specific programs. Why? To target that particular patient group, not for whole population, for that particular patient groups. Okay, so they can get benefit from this particular uh, programs, education programs.
These
Okay,
programs
so
are
they will.
nowadays introduced basically so that we're changing the mode of treatment from curative to preventive mode of treatment.
You can say that curative to preventive mode of treatment, but if I talk about, like I told you, okay, epidemiological and non-epidemiological conditions. Okay, so I can say there are certain. First, we need to decide what is the level of disease. If there is a pre-diabetic condition, we can do the preventive treatment and patient. But if the patient is already falling into the diabetic condition, in that scenario, we need to go for a curative treatment only. So depending, first, why we are doing these programs is to create the awareness. If you're talking about the preventive, we are creating an awareness. Once we are done with the awareness, because in India, population is not aware about the different medical conditions. Okay, once they are aware, first we need to create an awareness. Once they are aware, then they will turn up into the hospital now, because majority of people, they are not having their yearly health checkups. So if you are not going for hospital for 5 years, will you able to come across any disease condition? You will able to have कि तुम्हें rare of the rarest people will know कि they are suffering from any kind of disease. When the sign and symptoms of that particular disease condition will be expressed into that particular person, then only they reaches to the hospital. So there is a need. First, we need to create the awareness. So, what is the major? If I talk about specific disease education, means कि already that particular person is already diagnosed with that condition. Okay, he is already into the diabetic condition. Now, what he needs to be taken care. Okay, for pre-diabetic, your point is right. Awareness we can create, but for a disease condition, we are targeting to that particular person who is established case of HIV, who is established case of diabetes, who is established case of cancer. Okay, for these people, we are, Abhishek, it's clear now.
Yes.
Okay, so specifically when words come na disease specific education, it means ki that person is already has that specific medical diagnosis. Okay, I have written in this PPT also, patient receives the target education and resource tailored to their specific medical conditions or diagnosis. Means he is already diagnosed. So we are not doing for any preventive kind. We are doing it for diagnosed category. Okay. The education content may cover the disease, pathology, symptoms, risk, treatment options, self-treatment strategies, and preventive measures. Okay, so preventive measures in which scenario? For example, the person is suffering from HIV. Okay, AIDS. So he is the diagnosed condition, but he cannot spread to other person. For that preventive reason, I'm talking about over here. Okay, clear?
Yes,
So
ma'am.
healthcare providers reinforce the key messages and addresses the misconceptions and encourages the patient engagement in managing their health. Okay. Next is self-care instructions. As it's self-explanatory, ki we ask the patient how they can take care of their health on their daily basis. For example, if I talk about uh, breast examinations or all these things, na, in female we used to do on regular basis. Why? So they can check ki, is there any lump or not. If they feel any kind of lump or something, they can turn up to the hospital. That is one kind of self-care instructions we are giving to the female when they are into their I can say puberty phases or into their 20s 30s. So this is a thing that should be done on daily basis. Okay, next is why we are again second category if I talk about is related to self-care instruction is to prevent the infection to be spread if you are suffering from any kind of disease or surgery, so you have certain amount of open wound. Okay, you need to take care, disinfect that open wound and change your dressing on a regular basis. Why? To promote the healing. If you're not doing a proper cleaning or treatment of that particular wound, it will delay your healing or may cause any severe disease condition. So self-care instruction, again, it is a very important role. Okay. This includes dietary, wound care, and medical management. Okay. Other than this, we recommend physical activities depending upon the patients. Okay. On the there is a monitoring their symptoms and everything. We do the changes into the patients. Okay. Lifestyles and everything. Okay. Depending upon the need, what is the exact need of them. Next is the lifestyle counseling. For example, the patient is diabetic. For example, the patient is obese, or he is suffering from any kind of deleterious habits, or smoking can causing any kind of disease condition. So we ask them to drop these conditions or change their lifestyle. It will, for example, hypertension cases where we ask the patient, okay, medicine is fine, but in initial phases, if you change your lifestyle, your disease will be cured easily. So again, lifestyle counseling is very important in conditions like hypertension or diabetes. So these are the guidance or adopting the healthy lifestyle behavior to improve the overall well-being of the patient and prevent the disease severities if it is a diagnosed condition, or prevent the disease, okay, if it is an early stage. The counseling topics may include nutrition, exercise, stress management, smoking cessation, substance abuse prevention, and sleep hygiene. These are the basic things we need to do, okay? And provide the collaborate with the patient to set the realistic goals, overcome the barriers, and implement the sustainable behavior changes for long-term and healthy maintenance. Clear? So, uh, Abhishek,
Yes, ma'am.
already exceeded from some time. Should I continue or I end and we will ask for another session?
I think another session will be fine because I'm the only one person right now.
Okay.
Nobody
So
has.
we will, from next time we will start with the psychological supports and services. When your exam is going to be held for this particular topic?
The exam is going to supposed to start from 16th of May.
Okay,
But
I'll try
the date
to
sheet is
finish
not
on
yet
next.
confirmed as.
I'll try to finish on next Saturday, Sunday. This topic. Okay.